Hi, everyone. My name is Patricia, and I am a fourth-year medical student. Today, I will be presenting about ultrasound cost savings for patients at St. Vincent de Paul. So to begin, St. Vincent de Paul, as many of you may know, is a community health clinic in Phoenix that serves uninsured patients. And beginning March 2021, our very own Dean, Dr. Randy Richardson, actually began performing free ultrasound services for 1 hour per week. And I thought it would be super awesome to just look at the impact it had on the community from a cost savings perspective. And in regards to the methodology that we approached it, it is a descriptive retrospective study with the inclusion criteria of patients between the months of March to November of the years 2019, 2020, and 2021 who were referred for ultrasound from a primary care physician at SVDP. And this ultrasound study was performed either in the clinic for free, or they were referred to by an outside imaging center or to an outside imaging center. And the breakdown of the costs are, if it is performed by a volunteer radiologist, it is $0. And if they are referred to an outside imaging center by SVDP, there was a discounted rate that was arranged, and it would cost them $90. Lastly, for the flat rate, it would cost them $250 with no insurance. When we're looking at the actual sample size, something I want to address was in the year 2020, there is obviously a lower amount of ultrasound imaging studies done and a lower amount of patients that were seen in clinic. And the reason that the numbers are low is because it was during the height of the COVID pandemic. But if we were to look at 2021 and 2019 sample size, when that confounding variable was relatively controlled, we could see that even though there was a little less than 600 patients between the two different years, there was almost double the amount of ultrasound imaging studies that were performed in the year 2021. And the reason why this amount exists is because the old medical director in 2019 was very judicious about the patients who had their ultrasound studies done, just because he knew the costs that were associated for these patients. And here's a graph just to further visualize the spike in the amount of ultrasound studies that were performed for these patients. And we could see in 2021 from free services, it was a lot greater. Now, when we are looking at the cost, in 2020, we see it's $900, despite that it would cost $0 in theory for patients to get their studies done. And that's because actually the ultrasound studies were over the capacity of SVDP to provide it for free. So some of the patients unfortunately had to get referred to an outside imaging center, 10 to be exact, which is why $900 exists. But regardless of that amount, we could see that the theoretical combined flat rate cost for the patients would have been over $20,000. So there's almost a $20,000 in cost savings, which is in contrast to 2019, when it was less than $6,000 in cost savings with the combined cost for the patients, despite there being a lower volume of ultrasound imaging studies performed, which again attests to the power of how much you are able to save with a volunteer radiologist present at the site. And here the data shows the amount of ultrasound studies that were completed upon referral by a primary care physician. And the numbers show that there is a clear increase in the year 2021 compared to the years 2019 and 2020. And that's because the images were, one, both free, and two, on site, the barriers of transportation, time, and cost were relatively removed for these patients in comparison to a year like 2019, where patients, because they're uninsured, and that's also a marker of lower socioeconomic status, perhaps they were working during that time, they didn't have the financial means to get their studies completed, or they didn't even have transportation to go to these outside imaging centers. And between these different graphs, something that I found really interesting is that in the year 2021, there was a greater diversity in the amount of studies that were done. And that's likely because there was a higher volume of ultrasound studies done. And so that would increase the likelihood of more specialized types of ultrasound studies. But something that was important that I found also within these graphs is that despite the different years and despite the volumes, abdomen, pelvic, and retroperitoneal studies were the most popular. And that is an important teaching point to show, if we were to train other providers to provide ultrasound studies, what to focus most on. And these graphs steer us in the direction from an education perspective for that. Lastly, something I wanted to mention was the percentage of patients who receive referrals to other providers upon concerning diagnosis from their ultrasound studies. And we could see that it's well above a quarter for 2 out of 3 and above a quarter for 1 out of 3 of the years, showing that these ultrasound studies are actually really crucial for catching things that may have not been able to be caught if we didn't have an ultrasound study done. For example, a concerning thyroid nodule that needs to get checked by an endocrinologist. And it shows again the power of increasing accessibility to ultrasound imaging for these underserved patients. And conclusion, since I already really talked about a lot of these points, I want to talk about the future steps that we would do in the near future. And one, we hope to do a prospective study for this type of work because we want to increase our sample size. Because it's a relatively new study, we don't have as many patients in our database right now, but regardless, we're hoping to perform a t-test to assess if there is a significant difference between the proportion of patients that were referred for imaging. And we're also hoping to do an ANOVA test to really identify if there is a significant difference between the types of ultrasound imaging studies that were done, and also the different types of ultrasound imaging studies that were referred upon concerning diagnosis. And lastly, it's super important to really, for these findings to be brought to the public, because not only does it show the financial aspect of the ultrasound studies, but I think that it could really make a positive impact for physicians, residents, and even medical students to get involved, just not only to help people within the Phoenix area or in whichever community that they're coming from, but also because it reduces burnout as well to volunteer in these contexts. And that concludes my presentation for ultrasound imaging cost savings for patients at SVDP. And I just want to give a shout out to Isai, who helped collect the data, Dr. Anwar and Dr. Gridley, who were very instrumental in the research design and introducing about this topic in the first place. I would be happy to answer any questions that you all have.